Hello, welcome to Natural Health Today. I'm your host, Dr. Stephen Blomerth, and this is a show that runs on your audience participation. And we have you participate in several ways by sending in questions about yourself, loved one, family member, maybe a neighbor down the street. And you can send your questions via email to pbdchiropractic@gmail.com, or you can telephone my office at 978-535-6155, or you can even take an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts 01960. But whichever way you decide to participate in the show, what we'll do is we'll slightly disguise your name so people won't know the exact nature of the problem you're asking about. But we'll talk about natural health means to help you, or to give you an idea of who to turn to for help. Because after 37 years of practice, I've learned that probably 80 to 90% of the most common everyday problems that people have, they don't require drugs, they don't require surgery. What they require is some form of intervention and your participation to get better by the four basic pathways that I see involved with natural health. The first pathway that I think of when I think of natural health is manipulation of joints that are stuck, because a joint that is stuck and not moving correctly has far-reaching effects not only in the area where the joint is stuck, but also in the entire body. So a person who has a problem with their foot, sometimes they can have problems all the way up to their jaw. Another way that we help people get better is with specific muscle therapy or fascial manipulation. Because when muscles have trigger points, or when muscles just have tight points that don't move well, they also can cause far-reaching effects with pain, not only in the immediate area, but far-reaching, far distances away. For instance, there are a chain of connections that run from your feet all the way up to the top of your neck and insert into the back of your head. So anything wrong in that chain, from the foot all the way up to the top of the neck, can result in problems anywhere along that chain. The third way that we talk about helping people with natural health means is via exercise. And sometimes it's showing people which exercises to do. And in particular, we don't give exercises that are gym-based. We don't give any exercises that involve weights or any equipment, because those exercises are the types of things that people get anywhere and everywhere. In fact, they're bombarded with those types of exercises. Those exercises are too well known and people do too much of them. I just saw a patient a few minutes ago who does 100 crunches per day because he thinks it's going to help him lose weight in his abdomen, and nothing could be more wrong. But we give exercises that help you without weights, but they're not necessarily easy, but they help build what we call stabilization. You don't need to be a muscle-bound person or a big weightlifter just to be stable and healthy. It's not always about being huge or being so strong you can pick up 100 pounds in each hand. It's just about being stable enough to go about your day-to-day tasks and not suffer pain and not have problems at the drop of a hat. And the fourth way that we talk about when we talk about natural health care is nutrition. A lot of people confuse nutrition with what supplements you take. Sometimes supplementation is a good idea, but probably the longest and most powerful thing you can just do over time is just proper eating. And the food pyramids that the U.S. government puts out are totally out of whack and wrong. And so if we get into talking about nutrition with people, we usually talk about which foods a person should eat, as well as any supplementation that they may take. So those four basic pathways help with probably 80 to 90% of day-to-day problems that people have. And none of these involve drugs, none of them involve surgery. So with that, what I'm going to do is I'm going to put my reading glasses on, and we'll try to answer some of the questions that have come in from our audience since our last episode. Okay. Lee writes in from Middleton, and she says, a few months ago, I hurt my back trying to take out a big tree root on my front lawn. That pain has eased up a lot now, but my right foot is killing me. Can pain travel like that and have one part of the pain go away and another act up? Okay, so just to reiterate, Lee was working in her front yard. She says she was taking out a big tree root, and she had a lot of back pain. And that seems to have gone away, but now she says her right foot is killing her, and she doesn't know if it's related or can pain travel from one area of the body to another. That can be difficult for people to answer. But there's a few things that you can do for yourself to check yourself to see if that pain is coming from your back or is coming from your foot. Sometimes people can have two problems at once, and that's the hardest thing for people to understand. People think it has to be an either-or situation. You can have foot pain on its own, but you can also have some foot pain referred from your spine. So here's what I would try doing. If your foot is hurting you and you're feeling pain in a certain area of your foot, go to that area, or if you have a hard time bending down and getting to that area, have someone else just take the hand and go to the area where you feel your intense pain. Just have someone press right on that area. If it's strictly from the foot, you will have more pain. And so that'll answer your question right there. The pain is stemming from the foot. Case closed. But a person may not be sure about that. The other thing is, try moving your torso. Lean forward, lean back, lean to the left, lean to the right. And also rotate your trunk. If any motions of your spine bring out pain in your foot, that's an indication that the pain is coming from your spine, but it's felt in your foot. Well, how can that be? That can be when people have something called a slip disc. A slip disc is a bit of a misnomer. There's no real slipping of the disc. The disc is like a tire. There are all these fibers that are interlaced like that, and sometimes some of those fibers break. They let out this thick goo that's inside the disc, which is a little spacer between your vertebrae, and that can press on a nerve. If it presses on one area of a nerve, you might feel pain in your low back. If it presses on another area, you might feel it in your buttock area. If it presses on another area, you might feel it in your thigh. If it presses on another area of your leg, if it presses on still another area, you may sense it in your foot. In that case, there's nothing wrong with your foot, but your foot can have agony without necessarily having any pain in the back. It all depends upon, if you have a slip disc, where along the nerve your disc material presses. Could a person have both going on at once? Yes, you could have a problem intrinsically due to your foot at the same time as you have something wrong in your back, and that can be a real diagnostic nightmare. So do you think you should go to a surgeon first off? Well, you might need a surgeon if you're having what we call foot drop. In other words, if you can't walk right, if you can't pick your toes up off the ground and you have to throw your leg off to the side, that's an indication that you're getting some paralysis of the muscles that help move the foot. And that means, yes, you need to consult with a neurosurgeon. If you're just having pain but no loss of sensation into the foot, no loss of strength into the foot, going to a chiropractor is going to be a wise idea, because a chiropractor will be able to diagnose and treat either the foot or the back, or even help you out with a disc problem in a non-surgical fashion without incurring the dangers of surgery, and bring you back. Because having a slip disc in the back, it doesn't mean you necessarily need surgery. Very few people actually need surgery, even if they do have a slip disc. But in the situation where you have foot drop and you can't pick your toes up off the ground, or you can't, say, walk on your heels, or if you can't walk up on your tiptoes, you can try a simple test. Can you walk on your heels? Can you walk up on your tiptoes like a ballerina? If you can do both, that's a sign that you have pretty intact nerve flow down to the muscles in your legs, and you don't have to worry about losing that strength. If you can't either walk on your tiptoes or if you can't walk on your heels, that's a sign you should consult with a surgeon. So I hope that'll help, and hope you're out of pain soon, because I know that can really take a lot of energy out of you, particularly when you're going into the Christmas season. Okay, next question comes from Adam. He writes in from Danvers. He says, I work in construction, and I got some pain in my left buttock last week after standing on a ladder for 3 hours. My girlfriend says it's because I put some weight back on, but I think it's from standing on the ladder. When I get home, I'm too tired to do any exercises, so what can I do? Well, there's a lot of different issues there. Adam thinks he has pain in his buttock from standing on a ladder. His girlfriend thinks he has the problem because he's put some weight back on. He uses the term back on. In other words, he apparently has had too much weight. He lost it, but he put the weight back on. So he ends up by saying he's too tired to do any exercises, so what can I do? So that means to me, is he asking for exercises that help him lose weight? If that's the nature of Adam's question, exercise is involved about this much with you losing weight. Exercise does not do that much to help you lose weight. The major thing that helps you lose weight is stopping eating carbohydrates that have a high glycemic index. We've talked many times about what a high glycemic index food, but let me just talk about them across the board. The things that have a high glycemic index are all grains, so all bread and all pastas are going to have a high glycemic index. Potatoes of any type, and that would include sweet potatoes, would have a high glycemic index. Certain fruits, which fruits? The fruits that taste most sweet, so all the melons as well as pineapple, those are all examples of high glycemic index foods. Those all have to be eliminated in order for you to lose weight. But if Adam is not talking so much about losing weight, he's talking about doing exercises. What exercises will help you most if you have to stand on a ladder all day? Well, the type of exercises that I give my patients are called foundation training exercises. You can find them online at foundationtraining.com. They require no equipment at all. They are stabilization exercises. Because if you are standing on a ladder all day long and perhaps reaching up and doing work overhead, because a lot of times when people are on a ladder, they're up there because they can't reach from normal standing on the ground, you need to be very stable. And foundation training exercises work the stabilization muscles. Are they just one exercise? No, there's dozens of foundation training exercises, but they are the best bet. They take the least amount of time to do, they have the largest payoff, and they actually help you decrease your pain. So Adam, thanks for that question. Who's right, whether is it Adam or his girlfriend? It's probably more likely that Adam is unstable than that his pain is just from having regained weight. But having regained weight makes you pro-inflammatory and have a little bit more strain on your back. So they both may have a little bit of right behind them. Okay, our next question comes from Jerry, who writes in from West Peabody. He says, I know this is the cold and flu season, and everyone says that I should take more vitamin C, but I can't because I'm allergic to it. What can I do? Jerry, that's not the first time I've heard that people say that they're allergic to vitamin C, and I'm sorry to hear that, but I'm also more sorry to tell you that you're not allergic to vitamin C. People cannot be allergic to vitamin C because you absolutely must have some vitamin C for many different processes in our body, but probably the most important process that requires vitamin C is making something called collagen. What is collagen? Collagen is a reinforcement substance that reinforces tendons, ligaments, blood vessels. Collagen is everywhere, but you can't make collagen unless you have adequate amounts of vitamin C. Just about everybody may have heard of a disease process called scurvy. Scurvy is very rare today because some type of vitamin C is available to just about everybody. But once upon a time, particularly in Navy crews that would go out in the British Navy, and they might be on board a ship for a year and a half, there was no fresh vegetables, fresh fruits that would contain vitamin C. People would come down with scurvy, and they would have symptoms all over their body. They would have their teeth falling out of their head. They would get bleeding because they would start to have what we call capillary fragility. And people can eventually die from scurvy. That happens so seldom these days that it's unlikely to be the case. But it just goes to show that nobody can be allergic to vitamin C because we cannot live without it. But you might be allergic to citrus products because most people think that vitamin C, well, where does it come from? Oranges. And it is quite possible to be allergic to or have sensitivities to citrus products. So what are citrus products? Well, that would be lemons, limes, grapefruit, oranges. You may be allergic or have a sensitivity to citrus products or citric acid, but you can't be sensitive, you can't be allergic to vitamin C, you can't live without it. So what can you do? There are many, many sources of vitamin C besides orange juice and grapefruit juice or lemon juice or lime juice. It's in cherries. You can even buy supplements of vitamin C. You don't necessarily have to eat fresh fruits. Eating fresh fruits, not a bad idea, but if you find that you tend to have a reaction to many fruits, you can just buy a vitamin C supplement. Don't stay away from taking vitamin C just because you have some type of sensitivity to citrus products. Buy some vitamin C. How much to take daily? Everybody's different, but I'd say a minimum of 500 milligrams a day, particularly in the winter months. You might even double that. Does it have any downsides? No. If you take too much vitamin C, it can make your bowel movements a little bit looser. That can be a plus for some people who might have constipation. If you have loose, runny bowel movements from vitamin C, just back off, take a little bit less. You need it. We don't get it in everything. It doesn't have to be a citrus product to get it. But thanks for that question. Okay, our next question is from Alan. He writes in, he says, my knee has been hurting and my doc says I have water in the knee. Are there some pills I can take to get rid of the excess water on the knee? He didn't really tell me what to do. Okay, well, water on the knee is an expression, and it's not really water that's quote-unquote on your knee. People get quote-unquote water on the knee if they have to do a lot of kneeling, or if they do a lot of work that involves pounding on the knee. There was a word for it once upon a time housemaid's knee, because once upon a time hard-worked housemaids would have to be down on their hands and knees to scrub floors in a house. The water in that area is actually something called synovial fluid, and the synovial fluid is inside these little sacs that occur everywhere in our body that the bone and our skin are very close. So an example could be in our knee, because if you put your hand on your kneecap, you can feel the bone is a very short distance away. Same with your elbow. It's just a short distance between your skin and the joint in your elbow too. So we have these little fluid-filled sacs in our knee, and our elbow, and many other places around our body, wherever the bone and the skin are close to one another. Those sacs are called bursa. It's spelled B-U-R-S-A. And just about everyone has heard the word bursitis, or it would probably be easier to understand if I said bursaitis, which would mean inflammation of a bursa. When a person has bursaitis, whether it's in the knee or the elbow, our body responds to extra strain in that area by making a little bit more fluid. Why? Because it wants to bring a little bit more cushioning to that area. Having that extra cushioning in that area is not bad, because it's a sign that the body is trying to do something to protect itself. But many medical doctors would go in there and they would take out that extra fluid. It's kind of okay to take out that extra fluid, although sticking a needle inside a bursa does open up the possibility of infection in the area, but drawing that extra fluid out does make the person look better, because other than that you have this swelling in that area. But even more important, you need to eliminate the reason why that extra synovial fluid, why that extra bursa fluid is in there in the first place. So if it's been from doing a particular activity over and over again, you have to stop doing that activity or somehow pad that area so that your bursa doesn't get inflamed, it doesn't make that extra fluid. The reason for having that problem in that area is some activity that's irritated the bursa in the first place. Just drawing the fluid out isn't going to remove that activity, and it'll actually diminish the amount of protection we have in that area. So we want to decrease the inflammation in that area. Taking different cortisone or a shot of cortisone in the area will symptomatically make that area have less inflammation, but it won't get to the reason behind it. And cortisone isn't good for your liver. It's not good for the cartilage of the underlying joint either. So it's not a great solution. It's a very temporary stopgap solution to the problem. So water on the knee, no pill that's designed to make you excrete water. No water pill is going to get rid of water on the knee. The water on the knee isn't truly water. It's bursa fluid to lubricate an area that's been traumatized by some repetitive activity. But thank you for that question, and let's go on to our next one. Okay, Jamie writes in from Danvers. He says, I do about 100 crunches every day, and it has been working for me. My pants fit much better. But I still have a bit of a gut, and what is the best way to get rid of the rest of the gut? Well, I think we already mentioned that earlier. When people do 100 crunches per day, or 50, or however many crunches that you do, it's not really working on the fat that causes people to have a gut. It can, to a certain degree, strengthen your abdominal muscles, but not much. It doesn't really strengthen your abdominal muscles as much as other exercises do, and it does produce overly strong flexors of the body. Flexors, I'm going to turn sideways just so you can see. Flexion of the body is when our body goes forward. So every time you do a crunch, whether it's a sit-up or on one of those machines that does this, it strengthens the flexors of the body, the muscles that pull us forward like that. Well, all the muscles that pull us forward, they get strengthened by almost everything we do, including all the sitting that people do. We have too much tightness, we have too much strength in the flexors of our body. We don't have so much strength of the other muscle groups in our body. So if you want to really firm up your abs, doing 8-point planks, such as taught by the foundation training people, is a great way to do it. Remember, I said 8-point planks, so there's going to be 8 points of contact on the floor. That's a very special exercise. You can find it online, 8-point planks with the foundation training people. You can find it on YouTube. You can see how to do it. It's not so easy as you think, but just doing some decompression breathing, as I taught you on a different show, that's a way to help your abdominal muscles. The biggest way to lose that extra little bit of gut is something I mentioned earlier, just cutting down on carbs. Well, I don't want to give up beer. Well, if you want to lose weight, you can't continue to drink beer. That's all there is to it. Well, beer isn't a carbohydrate. Well, you're right. Alcohol per se is not a carbohydrate, but it might as well be, because your body treats it in the same fashion. It raises your blood sugar level far too quickly, and it causes you to put out insulin. And that's the reason why people store weight, because of too much insulin in our body. Insulin is a fat-storing hormone, and it also plays havoc with just about every hormonal system in your body. So if you really want to get rid of the rest of your gut, cut down or eliminate all the carbs. I'd say the one form of carbohydrate that you can have is beans. All the different types of beans, chickpeas would be fine, but standard carbs like bread, pasta, sugar, fruits, not a good idea. So we've just about come to the end of our time for our show today, and I want to thank you for watching Natural Health Today. I'm your host, Dr. Stephen Blomerth, and this show is dedicated to talking about problems that you might have or a friend. So participate in our show. Send in your questions to pdchiropractic@gmail.com, or call my office, 978-535-6155, or send me an old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Evening, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll read your question and we'll slightly disguise your name so your friends won't know what kind of problem you might be inquiring about, and we'll talk about natural health means to get you better. Thanks for watching. See you next time. Dr. Stephen Blomerth. Bye-bye.